This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome into the program. Dave Wilson and Sarah Giosi with you. This morning, got a couple of guests on the line. Wilma Sternthal, Executive Director of the Suites and the Village at Heritage Point. Cindy Horner, Director of Assisted Living, joining us this morning. Good morning, guys.
Good morning.
Hey, thanks for taking a few minutes with us. We're going to be talking about assisted living over the next half hour or so. But before we get into today's subject, I think both of you have been on before, correct? If I remember, if my notes are proper?
I have been. This is Wilma, and I have been. This is Cindy's first time.
Oh, okay. Well, Cindy, since this is your first, since Wilma's an old guest, we've talked to her before. Cindy, we always like to get to know our guests a little bit. Tell us about yourself and how you ended up in the position you're currently working in.
All right. I am a local Fairmont girl. I worked for another company and prior to coming here and met Wilma and absolutely fell in love with the Suites at Heritage Point. And when offered the position, I jumped up and down and squealed and said, yes, please, and came here. When I started out in nursing, I've been a nurse for 38 years. Geriatrics and working with the elderly population was really not something that I thought would be an interest to me. And lo and behold, it has actually become the love of my life, and this is where my heart beats, is with the geriatric and elderly community.
Why is that so rewarding? I've heard this time and time again, and my wife's grandmother is in assisted living, and I hear it from the staff there. Why is it such a rewarding career?
Well, when you stop and think, our residents here are about 77 to 100. We actually have an individual here who's 100 years old. Wow. Living in an independent apartment. And the thing is, when you really stop to think about it, these folks are in the final chapter of their lives, and we get to be written into their story. And it is quite a blessing to realize that we get to have such an impact on these individuals. So it really becomes, it's not a job, it's a heart story. So it's a blessing. And I, really didn't realize that at the beginning of my career that this is where I'd end up. But I cannot imagine my life being any more blessed than working with this population.
And Wilma, I know you're an old guest on the show. You've done this before, but just refresh us a little bit. Tell us a little bit about yourself.
Okay. So my background is critical care nursing, critical care management at the end of that chapter of my life. And I just wanted a change. And so I took a position as a director of nursing and assisted living just till I found the right job, or so I thought. And then my story is exactly the same as Cindy's. I just fell in love with it. And I can tell you, when I was in nursing school, I was like, I don't ever want to do whiny women and babies or old people. And had no desire to do either one. But it was a very short time that it took me just to fall in love with this. And so I've been doing assisted living, independent living, nursing now since 1998. And I love it and wouldn't want to do anything else with my life.
Well, before we hit the break here, guys, Wilma, rumor has it there's some exciting news to share. So you want to let us in on it? What's the news?
Sure. So, we've been residential care for 21 years, and that's a level where residents have to function a little higher than assisted living. But we saw a need to make a change to a more comprehensive level of care. And we had our final inspection on September 16th. And the Suites at Heritage Point now is licensed as assisted living.
What does that mean?
Okay.
Well, when we first opened in 1999, that level of care was easily met the needs of our population. But right now, residents are moving in a little later in life, and due to the healthy lifestyle that we afford them here, they are staying a lot longer. And so in order to adapt to those evolving needs of the community, we recognize a need to make that change to assisted living. Under residential care, residents had to completely self-preserve, meaning they had to get up out of bed, out of a chair, and out the fire exit under their own power. And we found that residents were starting to have a need where they might just need a little bit of assistance with that. Someone to walk with them, someone to be present and be there for just kind of guarding them when they get up or down. And our previous license did not allow us to do that. So this licensure will allow us to provide that little extra support that we couldn't in the past.
All right, we'll get into more detail about the changes, what it all means. And honestly, if you this change sounds like a very positive one, because what I heard there was people are living longer and staying longer and they're enjoying life. We'll get into all of that coming up on the other side of the break. Wilma Sternthal, Executive Director of the Suites and the Village at Heritage Point. Cindy Horner, Director of Assisted Living, joining us this morning on Mon Health Talk on WAJR. Our guest this morning, Wilma Sternthal, Executive Director of the Suites and the Village at Heritage Point. Cindy Horner, Director of Assisted Living.
Now, right before we took the break, you made the big announcement. For folks that are just joining us, why don't you make that announcement one more time?
Okay. So after 21 years of doing residential care here at the Suites at Heritage Point, we have changed our licensure to a more comprehensive level of care, and that level of care is called assisted living. So that means that we'll be able to provide a little bit more support to our residents than we were able to do in the past because of licensure restrictions.
Why did you see the need to make this change?
As our residents age in place, they don't, on the previous licensure, if they could no longer get themselves out in case of a fire or some other emergency, we would have to discharge them to a higher level of care. And this is their home, and they do not want to leave their home here. And our independent living residents, once they decide that they want to make the move, they sometimes question whether they wanted to move over to the suites, knowing that they might have to leave. So this new licensure will probably prevent us from having everybody leave to a higher level of care. But there'll be some of that still, but for the most part, most people will be able to spend their days with us.
Is there any other way? I mean, I think you just pretty much answered this, but besides what you just said, is there any other way that this could impact your current independent living apartments?
It will not impact our independent living. So we have 90 independent living apartments. Those will remain independent living. We will have the same capacity in our assisted living. We are licensed for 44 individuals in assisted living.
Okay. And then, again, you already touched on this, but why is it such a good thing for the suites? Besides not, being moved out of your home in this community that you really build, what are the other benefits to this?
I think I'll let Cindy handle that one.
Yeah.
The benefits to that are that the residents are able to stay in their home longer. Before, unfortunately, if they didn't meet our scope of care, which Wilma described to you a little bit ago, about being able to get up and out of a chair, out of a bed, and out of an emergency exit on their own accord, that actually caused us to have some of our residents leave because they couldn't meet that under our licensure. That was heartbreaking, to tell someone, I'm sorry, but you've declined to the point we can no longer keep you here under our licensure. So because of that, we really researched and looked into switching to the assisted living in order to not have that conversation with our residents and their families. They can stay in their homes. We can care for them longer. And it just makes sense that as our population ages, that we are able to meet their needs and keep them in their homes.
Can you describe the different types of, arrangements that are available for, someone who might be considering this type of a move? Because you can still live a very independent life, and you can also get the assistance that you need. Can you describe, again, I don't know if arrangement's the right word, Cindy, but
Sure.
the different types of care, that are available?
Yes, sir. I'd be happy to. With that, we are able to assist them. Let me start with this. They live in independent apartments. Some of them have chosen to live in a one-bedroom apartment that has a little living room area, a little kitchenette, and others have chosen to just live in one of our alcoves. Why that word slipped my mind? Live in an alcove, which is like a little studio apartment. They still have their own private bathroom. They still have an area for a kitchen table, things like that. They're kitchenettes. So they have that independence. Some of them need more care than others. Some have a little bit of dementia, and we can take care of that with no issue. But we have nursing staff 24/7 that can meet the needs. All of the medication administration is done by them. We have aides around the clock, nursing assistants, who will assist with all activities of daily living, from bathing to grooming and those types of things that they may need. Everybody is at a different level. No one is at the same level of needs. So we address those independently. And that's pretty much it. We serve 3 wonderful chef-created meals per day. They are ordering off of menus, so it's not the same food. They're not going into a dining hall where they have to, pick this or that. We hand them a menu. They circle what they want. They're spoiled. We love it.
I always tell my wife's grandmother I want to move in with her.
Yeah.
And which she always kind of gives me a wink and nod, said anytime you want. But that's a different story for another show.
Oh.
Hey guys, we got to take a break. When we come back, how COVID has affected. We've talked a lot about protecting our most vulnerable populations, and certainly our grandparents and great-grandparents among them. So we'll talk about that on the other side of this break. You're listening to Mon Health Talk on WAJR. We're talking assisted living this morning with Wilma Sternthal, Executive Director of the Suites and the Village at Heritage Point, and Cindy Horner, Director of Assisted Living.
All right. So again, right before we went on break, we started talking just a little bit about COVID and sort of a teaser on the fact that, this is a vulnerable population, and this has been a year of really needing to be able to support and pay attention to that. So how are you? How has COVID-19 impacted the way you work at the Suites at Heritage Point?
So tell me about it. It's been a long year. I started in January looking at the state of Washington. If you all remember, initially that's where a nursing home community actually got started with COVID, and it was very frightening to me as I, understood it would probably head our direction. So we've actually been looking at this for a long time and making plans, but officially started in early February. The safety of our residents is our main priority, and we have taken extensive precautions to keep COVID out of our community. And so far, we've been successful in our efforts. Our visitors and staff are screened upon entry for temperature, symptoms, or possible exposure. We've limited the need for our residents to leave the community by implementing personal shoppers, telehealth visits, Zoom conferencing, and our life enrichment manager has been extremely creative and deserves a lot of kudos for her creative techniques and developing activities that have fostered resident engagement throughout this mess. We were able to do a few outdoor concerts over the summer where everybody was spread out all over the lawn and 6 feet apart, distanced and masked. And we do FaceTime visits with families and friends. We had May, it was still newish and didn't know what to do. So in May, we did a Mother's Day drive-by parade that was wonderful. We were able to get the sheriff and the volunteer fire company and the Morgantown City Fire. And it was like a real parade. My idea was, let's just get some cars of family members and they could put a sign on a car, hi grandma. But It ended up to be like a full-fledged parade, and it was just wonderful. And our residents and families are very, very grateful to what we've done so far to keep COVID out of our community.
Hey, Cindy, as far as the residents go, how have they adjusted? You talked about all the efforts, but how have they handled this? How have they adjusted to all of the things we've had to deal with here?
They've actually done surprisingly well.
Good.
They take care of each other. They know about social distancing. They keep their hands sanitized. I've actually spent lots of time with the residents, actually one-on-one. The staff members have been even more attentive than they were previously, because we know that with this, for them not to be able to have their families coming and going the way they did previously, families are still permitted in. We don't have a problem with that, but we're just being very, very cautious and asking that, that the families be as careful as we are about social distancing and staying home and, not traveling and things like that. So it's actually brought all of us closer, if that makes any sense, because we've been together for so long. But we're keeping activities going and things to keep them engaged, and it's actually going a lot better than we had previously anticipated that it would.
No, it all makes perfect sense, and if my wife's grandmother knew how much I talked about her on radio, she'd probably scold me. But she said the same thing. She said, "Hey, we're in here together. We got to entertain ourselves somehow." So it is what it is, as they say in 2020, guys. For folks listening who may want more information on the suites and the Village at Heritage Point, where can they get that information?
Well, you can call our phone number at 304-285-5575. Ann Zitney is our Director of Sales and Marketing. You can speak with her directly. You can also go to our website at www.heritage-point.com and reach out to us that way as well.
Remember the hyphen in that. I always forget the hyphen when I'm looking that up. Wilma Sternthal, Executive Director for the Suites and the Village at Heritage Point, and Cindy Horner, Director of Assisted Living. Thanks, guys, for joining us this morning for this conversation. Appreciate it very much.
Thank you for having us.
Anytime. And, of course, you can always get more information on Mon Health over at the Facebook page.